Hello, happy Wednesday and welcome. And for our webinar Wednesday on connecting the dots, federal funding strategies for family resource centers. Today, we will explore how family resource centers can access, align, and maximize federal resources to strengthen families. The webinar today will feature federal funding experts and representatives of local California family resource centers that have effectively combined multiple federal funding sources to sustain and strengthen their services. Presenters today will shape practical strategies, challenges, and lessons learned in aligning federal funding sources to meet family needs. Just a few housekeeping issues before we get started. If you're joining us online, you can listen directly through your computer speakers. If you've joined via the phone number that Zoom provided, your line has been muted to minimize background noise. And for those of you online, please note that the link to the Dropbox folder will be in the chat, and that's where you can find the handouts for today that are referenced, as well as the PowerPoint PDF itself. In addition, you're welcome to put questions into the questions section at any time. The chat section is open for you to include any comments during the webinar, but we ask that you direct all questions that you're curious from our presenters, you'd love for them to answer in the Q&A section of today's time, to put into the Q&A questions section, so that way we can directly report those questions to our presenters. And in case you need it, we have live tech support in the room. If you have any technical issues, please reach out to them today in the chat. And as I mentioned, today's PowerPoint, handouts, and the recording of this webinar will all be available tomorrow on the NFSN website under the Webinar Wednesday page. And when you exit the webinar, we'll have an evaluation that will automatically appear on your screen. And we'd love for you to take a moment to complete this, as it provides us with valuable feedback to inform future webinars. Now, without further ado, would love to showcase and present our presenters today on today's webinar. We have Chris Stoner-Mertz from Stoner-Mertz and Company, LLC. She's a federal funding expert and a federal funding consultant of the National Family Support Network. We also have Dr. Pegah Fayed, the CEO of the San Francisco-based nonprofit Safe and Sound, and Dr. Ron Brown, President and CEO of All for Kids, which operates 14 sites throughout the LA and Orange County areas. And all of them are proud members of the California Family Resource Association, which is our California arm of the National Family Support Network. And they're helping to advance the work of FRCs across California every day. And I'm Brenda McChesney, co-founder and co-executive director of the National Family Support Network. So for today's webinar, we really have a lot of content that we've packed in here. So we'll have a little bit of a framing of the session and a brief overview of the National Family Support Network and a little bit about family resource centers themselves. We'll set the stage to understand California's landscape and the fiscal challenges. We'll explore models in action, as well as case spotlights of FRCs on the ground doing the work and blending and braiding federal funding. We'll explore cross-cutting lessons and tools that you could take back home to your organization to explore. And then we'll have time dedicated at the end for an interactive Q&A or to share any reflections that were and insights that you had from today's content. And then we'll close with our next steps. Before we, though, get into the nitty-gritty, we want to start with a little bit about you. We love hearing about where you're from and who's represented here in the room today. So before we talk about the NFSN, we're putting up our very first poll, which is, where are you joining us from today? Are you joining us from the Northeast, the South, the Midwest, the West, Canada, perhaps internationally? So we'll give you a second to complete that poll, and then we'll close it out to see who's here. All right, we'll go ahead and close that poll out. And, rarely do we have almost an equal tie. So it looks like we have a very US concentrated population with us here today, equally split across the regions of the United States. Excellent, thank you. And our next poll is understanding what your affiliation is. So this helps us to understand the perspective and the expertise that you bring to the table. So are you representing a family resource center, a family resource center network, perhaps another family support program, or maybe your parent leader representing early care and education, or a government sector, or perhaps a private funder? We'll go ahead and take a second to complete that poll, and we'll close it out here in 5, 4, 3, 2, 1. All right, we have a vast majority, almost half today, representing Family Resource Centers. Hello, and thank you for the work you do every day to support families across the country. We wouldn't be here if it weren't for you. Next up from that is the Family Resource Center networks. Those are the backbones of FRCs across each state in the country. And it looks like after that, some government officials representing and early care education. Thank you so much for filling out that poll. The next one gets us a little bit into the nitty-gritty of today's topic. So we'd like to know, how familiar are you with blending and braiding funding sources, specifically federal funding sources? So is this something that's like you would call yourself an in-house expert on, you'd be very familiar, or maybe this is really new to you and you realize in the current climate, we need this now more than ever. Perhaps it's not familiar, but please rank your perceived knowledge base on the topic, and we'll go ahead and close it out. Let's see what we have in the room today. Okay, so almost half of folks are not familiar. We have some that are somewhat familiar, and just about 25% who would consider themselves familiar to very familiar. So for those of you who are familiar in this space, we'll be asking some interactive questions in the chat along the way. And also, if you have any insights to share throughout the webinar today or at the end, we invite you to share them. And know that no question is a wrong question. So any questions are welcome here. So our very last question that we'll be populating is really, what is your organization doing right now? So to the best of your knowledge, does your Family Resource Center currently blend and braid federal funding? So yes, no, not sure, or just not applicable. And we can go ahead and close that out. And it looks like we have about an equal split between yes, currently blending braiding, no, not blending and braiding, not sure, and not applicable. So what's great to know is that you'll be able to walk away with some pieces that allow you to advance this within your own organization or help out other FRCs understand how they can blend and braid. Thank you so much for taking a second to give us a snapshot about you and your work. So now I'll share a little bit about us and our work. So the National Family Support Network was founded in 2011 when 8 states came together here in Colorado to have the conversation of what's happening and how could we advance the mission of Family Resource Centers to support families across the country. Today, we now have 39 member networks, which represent 38 states plus the District of Columbia, that showcase more than 3,000 family resource centers serving more than 2 million families annually. The newest members to join are Oregon, who joined earlier this year, and Missouri, who joined in May. The mission of the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state Family Resource Center networks and championing quality family support and strengthening practices. And our vision is essentially that every state has access, all families across the country have access in every state to strong, thriving Family Resource Centers that are backed by strong networks. In our work, we connect and convene members to enhance effectiveness and increase peer sharing. We also promote the family support best practices and evaluation by raising awareness around what quality family support looks like through the standards of quality for family strengthening and support. And we help to raise the visibility and the value of family support and strengthening networks in order to increase their strength and increase their effectiveness and increase access to families across the country. So let's just take a second to explore a little bit about FRCs, just in case it's a new concept to you or you're curious what they look like across the country. A Family Resource Center is simply a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of the Family Resource Center in Vermont, or they may be school-based, like the image you see on the right from Kentucky. They may be in rural settings, like the image on the left from Colorado, or in urban settings, like the image on the right of the Family Resource Center in Bronx in New York City. And Wherever they are based, FRCs work with families with an approach that is not only two-generational, but multi-generational, strength-based, and family-centered. Each of these concepts is immensely important because we look at the full systems that support families, including children, parents, and grandparents as well. Family resource centers are designed for all families, not just low income or highly challenged ones. So the support that they provide is non-stigmatized, making it more readily accessible to all. Program is often provided at no cost or low cost for participants. And the image on the right that you see here is of a family success center in New Jersey. There are actually 57 family success centers across all of the state's 21 counties. That means that each county has at least one family resource center that's available to all families in the community, because we know that all families benefit from two of the most important roles that we can have as adults, being parents and being spouses and partners. And two of the most important roles that we could have for which we typically receive no support or training for, hence the value of universal access to family resource centers. Very excitedly, at the end of last year, for the very first time, there was a federal statutory definition of family resource centers that reflects the pure essence of what an FRC is. It was reflected in the last slide, so I won't read it to you, but it's a celebration of a major milestone for family resource centers across the country. And family resource centers and our work in family support is based in strengthening the protective factors of the families that they work with. Strengthening Families Protective Factors come from the Center for the Study of Social Policy, and research has shown that these 5 protective factors increase family stability, enhance child development, and reduce child abuse and neglect. So as we're working with families, we want to support them in building these protective factors because we know that they make a positive difference. And simply put, family resource centers are just a good idea. They're cost effective, they're highly adaptable across various communities, be they urban, rural, or ethnic, and they have demonstrated successful outcomes through multiple external evaluations. And if you were to look at a snapshot of what a family resource center might provide in your own community, as conveniently located hubs, they bundle and co-locate many services that may be familiar to you, such as home visitation, evidence-based parenting education, health screening, play groups, fatherhood programs, family counseling, and food banks. And because they are shaped of, by, and for the communities that they serve, they often are staffed and hired by the families represented of the communities that they serve, which means that there's shared lived experience of the family served and have formal opportunities for families to influence and help co-design programs through parent advisory committees. Research study that was commissioned by NFSN in 2016 by the Omni Institute for Advancing Family Support and Family Strengthening Project showed that there are 4 core areas of that family resource centers provide across the country. The most common areas are parenting support and access to resources. And you'll see that each of these exists along a continuum of lighter touch to more intensive touch. For parenting support, that looks like parenting workshops or parenting support groups, all the way to higher, more intensive services might be evidence-based or evidence-informed home visitation programs. The same is true when we look at access to resources, that in a lighter touch format, FRCs provide enhanced information and resource and referral, the warm handoffs, if you will, all the way up to looking at co-location of resources for a more intensive service integration. Also, family resource centers offer child development activities and opportunities to engage parents and parent leadership, as an example, as parent advisory committees. And arguably as important as all the rest, and maybe even if not more, is really the role that FRCs provide in providing and building communities of peers, peer support and infrastructures, peer connection, social connection opportunities, so that families can develop social connections which reduce isolation and stress, which are highly correlated to child abuse and neglect. Okay, that was a whole lot of the nitty-gritty in the overview. I'm really excited to get to turn it on over to the meat and the potatoes of today's webinar, which is really looking at FRCs and the strategies to take federal funding and blending and braiding it, looking at statewide examples, looking at local levels, and it's my honor to turn it over to Chris Stoner-Mertz, our in-house expert on this topic, to take us through the next phase of today's webinar.
Thank you so much, Brenda. Nice to have every one of you, and I am so excited to be working with NSFN. So let me tell you a little bit more about myself. I am a consultant, um, but I have a deep background as a licensed clinician, foster parent, and CEO of a nonprofit. The last 6 years I've spent running a statewide policy and advocacy organization called the California Alliance of Child and Family Services that represents nonprofits working with children, youth, and families. And before that, I ran an organization, Lincoln Families, based in Oakland, where we stood up and expanded family resource centers to meet the needs of families in the Oakland and Pittsburgh areas. So we're going to talk a little bit first. My role here is really to give you a broad landscape of what's been happening in California. We have been through significant policy changes over the past 6.5, 7 years. I'm going to go into a little bit of detail because I think it gives you a good landscape to then understand what Ron and Pega are going to be talking about when they get into how they're running their family resource centers. And then we'll zoom back out and talk a little bit about strategies for organizations and also government and networks to be working on in your states. And excited to hear from you all during our Q&A. We can go to the next slide. Okay, we have many, many, many initiatives over the course of the last 7 years. Some of it thanks to our governor, who came in with a bang and with a lot of ideas. The first of which is an initiative called CalAIM, which stands for California Advancing and Innovating Medicaid. Of course, we call it Medi-Cal in California because we have to have our own name for everything. This initiative began in 2020 and has really been rolling out since then, different components of it. But probably the important components for you all to be aware of is that it changed some of the medical necessity criteria, particularly for children and youth, and their ability to access services, whether it's through a managed care plan or through their county behavioral health plan. And we do have two systems in California. We have the managed care plans, and we have carved out specialty services that address more significant needs, both for adults and children. A second component of CalAIM was really to integrate the health plans more readily in supporting behavioral health services. And I'll talk a little bit more about that in a second. To address population health and look at what are the proactive things that managed care plans, health plans can be doing to address the needs of children, youth, and adults. There was a goal to reduce the administrative burden that comes with providing Medicaid services. Three of the probably most important elements of CalAIM for a provider are three different types of services and service providers that were developed. One is enhanced care management, one is community supports, and both of these two types of service, which now can be provided by a community-based organization under contract with a health plan, are really addressing social determinants of health. So when you think about the types of services family resource centers do, these two types of services, both case management and connection with all of the different potential providers and supports, but also very concrete things like rental assistance, food assistance, respite care, those kinds of things come under those two broad categories. Community health workers were a new provider type, and I'm going to talk on the next slide about a range of provider types that have been added to California. But the community health workers specifically will help people navigate through the health system, but also to get some of those services and supports they might need to address the social determinants of health. We have also seen significant reform around foster care. This kind of connects to one of the other initiatives we'll talk about in a moment, the Family First Prevention Services Act. But in California specifically, the state Department of Social Services has forwarded a plan to change the way that providers are reimbursed for services for foster youth. The focus is on funding the supports and services based on a child's needs rather than where they happen to live. As you can imagine, that is a significant shift from where foster care, both at a state level, but even nationally, has really been for decades. This tiered rate system is really based on the results of the child and adolescent needs and strengths assessment that gets done for every child, or will at least get done for every child in foster care. That is how the local child welfare department, hand in hand with their behavioral health department, will determine the types of services and also where that child might reside. You can go to the next initiative. Thank you. This initiative, which we lovingly call BH Connect, stands for the Behavioral Health Community-Based Organized Networks of Equitable Care and Treatment. I always have to look at my notes on that one. I'm like, we really work hard on our acronyms in California. This is an effort to really tie together some of the things that are happening under the foster family, or the Family First Prevention Services Act, and what's been happening under the CalAIM efforts. There are a range of different streams in this initiative, which did require a federal Medicaid waiver. But there are workforce investments that both expand and diversify the workforce and support those who are doing work in the behavioral health field. It focuses on uplifting evidence-based practices. Some of those are specifically connected as well to the Family First Prevention Services Act, like family-focused treatment, multisystemic treatment, and parent and child interactive therapy, as well as wraparound. So those are kind of the four types of therapy interventions that the state is really trying to get folks to expand on and do more of. And they've provided new rates to provide these as a bundled service. There are also incentives for managed care plans, child welfare departments to work more collaboratively in serving children, and particularly for serving foster youth. And then there are some stipends. There are ways to get supports through Medicaid for children and youth in foster care. Let's go to the next one. Like I said, we have a lot of initiatives in California. There have been enormous investments over the last 6 years in school-based mental health. There have been literally billions of dollars put into things like community schools, partnerships between behavioral health, managed care, and schools. We'll talk a little bit more under another initiative about some of the details around that, but just know there's been a huge push in California to focus on mental health services in schools. We can go to the next initiative. Of course, you all know about the Family First Prevention Services Act. And I won't go into all the details of this. I think the most important point to make is that California has really identified family resource centers as one of the very important strategies that they're using for prevention. In 2019, California actually added family resource centers as a defined type of service to statute. And in the same way that has been done by NSFN and all of you in the federal statute. And you'll see as we talk some more, and probably as you hear from Ron and Pega, how much focus there is on utilizing these as community pathways and keeping children out of child welfare. Okay, next. This Children and Youth Behavioral Health Initiative, which was put into place in 2021 by our governor, has actually 14 different what we call work streams, from a virtual platform and apps that helped youth engage in getting support and help, to investments in workforce, to public education, and very specifically, the state has created what's called a universal or a multi-payer fee schedule. That fee schedule allows schools to either provide themselves or contract with a provider to do behavioral health services and supports with children and youth in schools and get those services billed to the managed care plan that child or family has. This is really an unprecedented new approach. There have been lots of challenges, as you can imagine, particularly in a state with thousands of school districts. And it is not a required service, so school districts have to opt into this. But again, real focus on bringing behavioral health supports and services to children and youth where they are. We also have the Behavioral Health Services Act, which is essentially a revision of a proposition that was passed by the voters in 2004 that requires that millionaires pay a 1% tax that goes specifically to the mental health, now behavioral health system. Several years ago, the governor and others said, we think we're not using this money as effectively as we could. It gets dispersed to counties, and county behavioral health departments decide how that gets implemented locally. But there are now new prescribed requirements with a real focus on addressing the issues that are impacting folks with chronic mental health issues or substance use issues and who are ending up homeless or are ending up with those conditions because they are homeless. So that has also been something that is in the midst of being rolled out and again, impacting California. So many, many, many things happening in California now with a great deal of transition also about to occur with all of the federal issues and funding issues that we're seeing. Okay, next slide. This slide really runs through, and I'll move through it quickly, all of the different provider types that have been added with a real focus on moving away from traditional kinds of, licensed clinicians. Not that those folks aren't critically important within the behavioral health schema, but there was a lot of emphasis throughout this process and these different initiatives to say, where could we be providing those services and also expanding and diversifying our behavioral health workforce when we don't necessarily have to have someone with a clinical license doing a service. So we have introduced peer-to-peer in schools, and there are, I know you don't know all these acronyms at the bottom that relate to funding, but these are primarily funded through state funds and initiatives. But a lot of emphasis on we need, if you're a high school student, you're going to much more likely connect to one of your peers than to a teacher or to a counselor. So lots of expanding happening there. Peer specialists, which includes adult peers, is a new approach and a new certification that an individual can get. You don't have to have a specific degree to do this. You do have to go through a certification process. I talked a little bit about community health workers. These are provided via contract with a managed care plan or health plan. So again, another new service and provider type that can really engage people and help them navigate the healthcare and behavioral healthcare systems. We have doulas to support pregnant and birthing parents. It is a new rate that is provided and can be billed to Medicaid. We have, through the Children and Youth Behavioral Health Initiative, a brand new set of provider types called wellness coaches that are focused on, again, providing that early counseling and support to students in schools so that hopefully you are both reducing their need for more intensive services because you're taking a preventative approach, and you're also expanding the workforce. You can keep going. These other two of these are already in place, but one of the things that has been added through legislation is the ability for a master's level person who is not licensed yet to be able to bill for services under managed care plans, which had not been the case before this new legislation was put in place. Okay, next slide. I'm going to hone in a little bit now on what's happening for foster youth specifically, and I do that because many family resource centers are very much the pathway to prevention of families ending up in child welfare. Just so you have a little background on California, we have 40,000 kids in foster care. It has been reduced over really decades, but since 2015, about 17,000 less. The state funding is realigned, which means the state provides the funding to the counties. The counties actually decide how that funding gets utilized. So 58 counties across the state, very different geographies, very different demographics. The state, of course, regulates what happens, but the counties really have a lot of independence in deciding how services get provided in their locale. I talked already about the state initiatives. Right now, California is not claiming any prevention dollars. Part of that is because of technology. As you can imagine, moving technology, even in a state as technology focused as California, through government is a challenge. So next slide. As I said, we really see family resource centers as a way to address the prevention components of FFPSA. And the California State Prevention Plan identifies FRC specifically as an essential component of this strategy. At least 8 of our counties have explicitly called out family resource centers in their own plans. And many reference CBOs or community centers or things that are essentially family resource centers as we know them. For those of you across the nation, you'll see here a list as well of the different states that have actually named family resource centers in their prevention plans. Okay, next slide. So the question is, what does this look like on the ground? And it's hard for you probably to see the details of this visual, but it's really showing how critical it is. And any of you who are running FRCs know you have to find diverse funding in order to keep those doors open. And there are, in fact, different ways to use government funding, Medicaid being a primary one, to be able to get services to the families and youth that you serve. As I researched for this presentation, I learned that close to 17, I think it is, states actually have community health workers as part of their Medicaid plan, which means if you are in a state where that is a type of provider, you should be looking into whether or not you can actually have a community health worker at your family resource center and bill Medicaid for that, because you're probably already doing those services. So how do organizations decide what funding to use and how to braid? That's going to be very much a local decision, and one that you are going to be talking with either your county and or your state about. As we know, each FRC is unique in addressing that community's needs. And so you really have to look at what are the sustainable funding matches to what your community needs are. Every FRC is different. If you've seen one, you've seen one, even though there are broad strokes, designations about what they do and what they provide. And you're going to see this now because we've got Pega from San Francisco and Ron from LA who are going to talk more about what they're doing on the ground. And then we'll come back for a broader conversation and Q&A about what things you might start to look for that you can use to support the work you're doing in your FRCs. I'm going to turn it over to Pega.
Thank you so much, Chris, and thank you to all of the organizers, Brenda and Chris and Ron, for including me in this conversation. It's really a pleasure to be here with you all this afternoon. My name is Pega Fayed. I'm CEO of Safe and Sound, and I'm here to share a little bit about what all that Chris shared looks like on the ground. Next slide, please. So I just want to start with sharing a little bit about Safe and Sound. We are a nonprofit that's been serving San Francisco and the Greater Bay Area for over 51 years with a vision of a future free from childhood trauma, where all children, families, and communities are safe, supported, and loved. And we do that through utilizing the ecological framework for prevention with goals across each of those levels, starting with children and families at the center and working our way through interpersonal relationships and social support networks, cultivating organizations, strengthening interconnected communities, and ultimately transforming policies and systems so that we can see sustainable change beyond the families that we serve in our FRC. Next slide, please. Just a little bit about what makes us stand out, and I'm sure with the poll that was done this at the beginning of the call, I know many of you are probably aligned with a lot of these principles, but Safe and Sound really focuses on prevention, And we want to ensure that families have the support that they need before a crisis occurs. And so that is how we approach our work as much as we can. We use a 2-generation family-centered approach, meaning we work both with the child and the parent and caregiver, and potentially other generations within the household. We focus on practice informing policy, which means that we really value both the lessons we're learning in practice and try to amplify that as we work on our policy and advocacy work at the local, state, and federal level. We have shown up in San Francisco as a network leader, meaning that we are a convener, we bring together partners, and really have the ability to make change through community given our leadership in the role that we hold. And lastly, we are client and data informed, and that we try to utilize data at every decision point that we can to inform how we do our work and how we make decisions. A little bit about the roles that we hold in San Francisco and in the community. First, we are a direct service provider. And actually, I'm gonna have you go to the next slide, please. Thank you. As a direct service provider, we offer many services that Chris shared in her opening remarks around parent coaching, counseling and education, care management, parenting classes, group workshops, family events. We also have a 24/7 talk line for parents to call and can be connected with a trained volunteer or staff person to help them either get connected to resources or just have someone to talk to in the moment of a crisis. We're also a capacity builder, and what that means is we really strengthen interconnected communities where all families have equitable access to resources and support that they need to thrive. We believe that connected, resource-rich communities create the conditions for child and family well-being. So we end up collaborating with leaders, public and nonprofit organizations and coalitions to build networks of care and try to remove as many barriers as we can to services so that families who, especially those that have been historically excluded from systems of care, can access what they need when they need it, again, prior to crisis in the family network. And so you'll see some of the things listed on that slide. We also, thank you, next slide. We also are an educator, so we build knowledge, shift attitudes, support behavior change through research and training, outreach and public education. And our work includes strengthening the capacity of various institutions that serve families, and through training, technical assistance, partnership, coalition building, and others, we help create organizations that offer trauma-informed services with knowledge, capacity, and support to really heal and be stable institutions for children and families locally. And lastly, we are an advocate. So we advocate for reforms that shift power and redistribute resources and really elevate the voices of those most affected by trauma, inequity. And we do that by influencing policy and practice change. And we've had success around transforming policies and systems so that they are responsive to the needs of children and families. So how do we do all of this? Because we need funding to do all of it. And I'm going to talk a little bit about the different funding pathways that we utilize here at Safe and Sound. The first that I just briefly want to touch on, which is really critical to all of the other components of the work, is our philanthropy work, and fundraising is crucial to our strategy. We raise funds both for Safe and Sound and on behalf of an alliance of over 40 plus family serving agencies that serve San Francisco, and we are the backbone agency for that. And so much of our fundraising strategy raises money that we distribute out to those organizations as well. And what's important about the philanthropic pathway is that it allows for flexibility for us to pilot new programs before seeking government funding. It helps cover gaps in restricted public funding and to be able to respond quickly to emerging needs. And so many of our fellow Alliance members in our Family Services Alliance have benefited from some of those privately funded dollars that we've subgranted to them for specific projects. But in terms of other pathways of funding, if you could just, go back to as I talk about this, and then I'll dig into the government. We also hold several contracts with the city and county of San Francisco to provide services to children and families and to build the field of family support in San Francisco. And so most of the funding is state and federal pass-through, with a small amount from voter proposition created funds and general city funds. And city and counties are able to contract for and disperse several of the funding sources to CBO partners to help achieve those goals. I'll talk a little bit about Medi-Cal reimbursement work that we are focused on, and then some of our fee-for-service for some of the training and technical assistance we offer in the field. But the key insight here is that there's no single funding stream that could sustain our work at the moment. And so each source has restrictions. Federal funds aren't flexible. State funds may be time limited, and city funds are subject to the whims of local budget pressures at times. And so the philanthropic base is crucial because it allows us to be nimble and fund things like field building that government grants won't always cover. But by braiding these sources, we create that flexibility and sustainability for all of the work that I covered quickly at the beginning of my presentation around direct service, education, advocacy, and serving as the backbone for a broader alliance of service providers. Next slide, please. We have, I wanted to deep dive into the government grants and contracts piece of our funding pathway. And so our child welfare system in San Francisco is handled within a city department called our Human Services Agency, which handles state and federal pass-through money. And HSA contracts directly with Safe and Sound, as well as other San Francisco child, youth, and family support organizations for services within the child welfare system. And for prevention work, including differential response, enhanced visitation, HSA funds go through work orders through an initiative called the Family Resource Center Initiative, which is managed by the Department of, in San Francisco, called the Department of Early Childhood, or DEC. So you'll see that on this visual here, there's many different departments across the city that offer a variety of grants and contracts to Safe and Sound that we blend and blade for a variety of our services that we offer. And what else I will say is that we've also received direct funding from the federal government through specific grants, like a HRSA grant that we received that was a 3-year grant to support some of our training and technical assistance of pediatricians that do ACEs screening and adverse childhood experiences screenings. So what you'll see here is that clearly there are a number of departments that offer us support through a variety of pass-throughs. Next slide, please. This is the Family Resource Center Initiative, which I wanted to talk about really briefly, which is before 2009, FRCs had separate contracts within 3 different departments in San Francisco, which would prove to be incredibly inefficient. And the FRC initiative unified this with a common vision, some shared outcomes, and coordinated funding. And this was really nationally groundbreaking. And this multi-department work order mechanism that is used in San Francisco is crucial because it allows the Human Services Agency to transfer blended federal, state, and local funds to the Department of Early Childhood without having to separately track which dollar goes where. Then our Department of Early Childhood is able to contract with the various family resource centers in San Francisco. And this reduces administrative burden dramatically and offers a unified service system for families that no longer requires various intake forms and all of the inefficiencies that come with that. And so you'll see that this initiative includes 26 neighborhood and population-based FRCs funded through these 3 departments that are listed here, with a total of about 18 million annually in dollars here that are blended. And each of these departments offer a portion of that. So whether it be our Department of Children, Youth and Families that, oh, this is supposed to say Children and Youth Fund, not fun. But that is a fund that was a San Francisco voter approved property tax set aside that contributes a portion of the 18 million through that department. Our Department of Early Childhood has state Proposition 10 tobacco tax dollars, which also referred to as First Five, and that also offers some funding through the Department of Early Childhood. And then we have our Human Services Agency that blends Title IV state funds and city general funds, but that's a small portion to cover some of the other work that's included under FRCs. And I won't dig into, the FRC work further, since Chris talked about that a bit. Okay, and then lastly, I wanted to just touch on the partnerships with Medi-Cal. So there's the Medi-Cal Administrative Activities, or MAW, which are generally administrative and outreach activities by community-based organizations and public entities aimed at helping people enroll into Medi-Cal and other related programs. And I think Chris touched on this, but for San Francisco FRCs, this is administered also through the Department of Early Childhood, and it generally brings in around $500,000 additional dollars annually for FRCs citywide. And some of the other funding streams that also Chris talked about that we utilize here in San Francisco are the Enhanced Care Management, ECM, for some of the personalized care coordination work, community supports for the non-medical benefits, and the community health worker reimbursement for outreach and connecting clients to resources. Next slide, please. So I just wanted to end with a couple best practices and some challenges. We found that ensuring that the various initiatives that exist are complementary and not duplicative, and that there's actually true integration across the system really helps with some of that blending and braiding of resources. Also, developing clear service definitions for each funding source is really important. Identifying a strong backbone organization in your region to coordinate efforts across several partners. If there are several partners in your region that do similar work, really coming together, we found that avoiding the scarcity mindset and coming together to collaborate and coordinate has proven to be a real best practice for us and getting better outcomes. And related to that, forming collaboratives to increase capacity and system building, because we want to create a system and a pathway where there is no wrong door. And by minimizing duplication and opening up the doors for families to access services wherever they can, across an alliance is really the ideal approach. Next slide, please. And then some challenges with blending and braiding funding is that determining the payer of last resort can be complex when there are multiple funding streams that overlap. Also, ensuring that back-end billing and documentation systems are organized and integrated is really critical, so that the staff that are doing the work can actually deliver case management and direct services without being bogged down with the typical administrative complexities. And additionally, political and policy uncertainties can obviously shift certain coverages and can affect long-term sustainability. So always being kind of flexible and nimble and proactive in assessing your funding strategy and advocacy is important given the context that we operate in currently. And lastly, just making sure to ensure equity and accessibility, as funding and documentation requirements shouldn't create barriers for families. And like I mentioned, the no wrong door approach is really important and can sometimes be a challenge. And this is just a little summary. So braided funding is like building a net and not a ladder. And so each strand alone could be fragile and may have gaps, but braiding them together creates this web of support that really catches families before crisis. And that's how we approach our work here locally. And then the backbone organization model is replicable. So trying to not reinvent the wheel and start from scratch, but really working together is critical. And lastly, the future really is about integration. Siloed funding creates siloed services. And so families don't experience life in silos, and braiding funding allows FRCs to provide these holistic, wraparound, family-driven support. And that's really what prevention requires of us. So thank you. Feel free to reach out if there's any questions directly to me if we don't get to them today, and I'll turn it back over to Chris.
Thank you so much, Pega. Wonderful presentation about living the FRC life on the ground and connecting how it all comes together. I am really pleased now to introduce Ron Brown, Dr. Ron Brown, who is the president and CEO of All4Kids. Ron,
Thank you,
over to
thank you, Chris. Yeah, thanks, and thanks, Brenda and Pagan. Really appreciate being here and all of your attendance here today. I'm hoping that I've worked hard to not be redundant. So a lot of the things that Pagan said and that Chris said about braiding and the funding sources, I really have taken a little bit different approach to look a little bit about structure and to challenge some of your thinking around that. So next slide, please. But before we get started, a little bit who we are. All4Kids is an agency that started in 1904 in LA trying to get children off the streets and to create child labor laws. It got involved in foster care in the 1930s and adoptions in the 1940s and did childcare for women entering the work market in the 1950s. It was working with group homes and decided that it wanted to get out of them in the 1980s and really focus on prevention. So in the 1990s, it was asked to start a system of family resource centers in Orange County. As mentioned earlier, we serve predominantly Los Angeles and Orange County, which is the county just south of Los Angeles, if you don't know. Disneyland's in the heart of all that, so that'll help you put perspective. We were asked to come down and start those FRCs. Currently, we're serving 70,000 children and families a year through a variety of programs. I'll mention a few of those as we go forward. So next slide, please. So as I noted, we moved distinctly towards prevention in the 80s, and in the 90s, we had one FRC in Los Angeles at the time that was focused on early childhood and served as our organizational headquarters. So as back please. We should be on 41, 42. So the idea being that we had our system there, our headquarters there, we brought in behavioral health to help cover the costs of the building. We had our foster care co-located there as well. We had some child programming going on in there. So as we looked at that, we were looking at a service hub approach where what was organizationally delivering. We're one organization really providing a variety of services, and all that it provides is in the community really wanted to do this. So I wanted to demonstrate how things have changed. As I mentioned, originally we had services provided primarily by our organization, and clearly we were providing some referrals, but we were very organization centric. We used existing contracts and grants and funds for service delivery and had a contract with the LA City for some funds. We would obviously use private dollars that were contributed to help support that. In the 1920, or actually in 2000, we decided to take a different approach. We asked ourselves what more we could do in the area of prevention. So based on this, we sought a site that could convert to an FRC where we could create co-located services. So our focus was providing safe and nurturing parenting, school readiness, health and emotional well-being, and economic stability, which really have evolved into the social determinants of health as we know them today. So, but knowing that others were far more competent and skilled in some of those areas, we built a space through a massive fundraising campaign where these services could be co-located along with our own. So the idea of having a number of organizations in one facility serving a community as a whole. And then by 2010, we realized that community needs based on the community voice were beyond even those present in the building. So when we sought to shore those up and to provide available services by reaching out and directly linking to other organizations to fill those in. So we created a linked community service building. So this process, each organization brought their own services, their own funding sources, but they were either co-located or they're directly linked out in the community, and organizations were providing their own, and particularly their own funding to the table as an FRC. Next slide. So when I think of our approach, again, I mentioned Orange County set their FRCs up, and they were using Title 4B, which is promoting safe and stable families. And the contracts to the lead agencies or to be a partner within these FRCs were very defined. So you got who, how much, how communication occurs, etc. So again, county funded at that point in time, federal funds to the state, to the county, and very, very defined. When we look at some of our more successful FRC experiences that have occurred, we've had opportunity to share a funding source. So looking at multiple organizations working collaboratively with shared funds. So not defined by contract, but clearly by partnership. And generally speaking, these are time-limited grants for a variety of service delivery models that fall within the needs of the community, but you come together with other organizations. Generally, again, time-limited, very focused. And also noted what's common is to our co-located approaches is that, again, organizations bring their own funding to the table. So when there's no defined funding source, people come, what they do is what they do, but we work collaboratively. So next slide, please. So to think about this is just another look at the previous slide. I want to note that the last two require more trust than a defined funding approach. It means that relationship building is required and that there's some semblance of shared vision for the community that's being served. It also requires far more open communication because, again, when it's not defined by funding, but you're working collaboratively, either bringing your own funding to the table or with shared funding, it really, really helps to be making sure that your vision is in alignment. Because what's going to happen is somebody's funding is going to roll out. How do you help bridge that, etc.? Next slide. So I brought this up because I think context matters, and who's driving the bus here, if you will. I wanted to kind of say that this is really important in many ways because, as Chris pointed out, the saying goes, when you've seen one FRC, you've seen one FRC. They're all different, which is really, really important. Orange County has a series of FRC that it helps to drive. It chooses where, it chooses who, it chooses how much. However, that doesn't mean that these are the only FRCs in Orange County. So LA County doesn't even have a funding source for FRCs at all. As a result, the county has no idea how many FRCs there are, where they're located, even who they serve. A few years ago, I did a bit of personal research and found that there were over 150. And at the time, I used the California definition of an FRC because the federal one hadn't been established. And that was by no means exhaustive. So what I found was something that you already know. FRCs come in all shapes and sizes and from a variety of perspectives, and they're driven by a lot of different kinds of things, like funding, like availability. So I say a church, a faith-based approach. There's a synagogue near downtown LA that's clearly an FRC by all definitions, and its services aren't limited by faith. However, its primary funding source is the faith community, and they support that. Historically, many schools in Southern California have been connected or even hosted FRCs as part of their approach to helping community. And a few years ago, the California Department of Education funded community schools using primarily state funds to support FRCs in schools. And we're required to reach out to organizations to be part of that. How do you be part of a community school? These are things that are available to you. And then more recently, as well, as was mentioned as well, health providers and managed care plans have also joined the FRC bandwagon. That doesn't mean that some haven't been involved for a long time, but now it's much more focused, and they're leading, they're partnering, etc., and they're using their funding to improve community health, which is exactly what you do in many, many ways, and you can augment that work. So finally, there's the CBO that's like us, or that's been traditionally doing this work to support the community. And in some cases, depending on their funding source, these may even be age-oriented or issue-oriented. So you have FRCs that come in all shapes and sizes. So I want to point that out, that there are other opportunities for you to engage with others. So next slide, please. Some key considerations. Money is a funny thing, and the lack of it can cause us to lose our focus at times. As money gets tight, we may forget or not even have time for community voice. So you already know how important that is. So I'm saying, as you get desperate and you're working hard, don't forget the community voice. Partnerships have the ability to bridge difficult times. And who's in your orbit that you align with and can create a shared vision? You know, Pagad talked about how they're all aligned and they've got this. So we don't have a structure like that. So you could be the one that creates that structure that she talked about, or you could be the one that joins this structure like that. So who can you create a shared vision with? And just because you're not funded for a service doesn't mean that you can't help provide it to your community. So reach out to somebody else, or get somebody else to help provide that as well. Of course, this all highlights the value of trust. And so I've this saying that we need to have a shared vision. So we go out as organizations and have a shared vision, because if we have that, then we're only going to conflict around our strategies to get there. That's far easier to get over than conflicting over a vision. So shared vision, then you work on strategies, you can get through those. But by building trust with other providers and partnering with them, you can grow the depth and breadth of services without, in some ways, you needing additional funding. Let them provide the funding. Let them be the experts in that arena. Let our old school barriers down. Nobody needs to be siloed anymore. And then I wanted to talk briefly, a comment about outcomes. So next slide. There are some really well-established outcome tools out there now, and you should be using at least one of them. This will support your voice to whomever you're reaching to, whether it's government, non-government, your funders, your community. And I'd be remiss if I didn't include community voice via some very reportable methods. So you have the protective factor surveys, and you can get data from them and you can use them. Brenda talked about protective factors and how we promote those. And the survey tool is a wonderful tool. It's easy, and it's easy to get people to use. And then really building a community survey, using the community voice as your voice too. It may not be how you get a specific funding piece, but it may be the thing that gets you over the line to get that funding, because the people that you're reaching out to know that you care, know that you have community voice in hand, and know that you can use that voice and lift it in a way that says what you do is important. So next slide. So I just wanted to finish up with a comment about some challenges. So really, funding can define partners, but not how to solve problems. So yes, so our contracts in Orange County defines the partners, but it doesn't define how we solve our problems. So that's an important component as you're working with an FRC, and if you're working beyond your own shore or outside your own organization, work on how to solve those problems. Work on how to partner and be a good partner to the people that you're working with. And remember that you have a shared vision, and that's the piece that you're not conflicting about. Funding has limitations. Who gets cut when the funding does? What happens when the squeeze comes? What happened? I was around in 2007, 2008, 2009 when we saw the Great Recession, and it was a scary part. And so how do we have these discussions that are really important to have with each other? as we go into it, and keep the focus on the vision as being the primary thing, as opposed to ourselves. I look at that as there's enough work for all of us out there. So how do we support all that work? Funding has limitation. We only have enough resources for it. I say if it's about funding, it's not sustainable. So how do we create some sustainable models? How do we engage with our community to help sustain the work that we're doing? And how do we train them to do that? And then, of course, the limits of our funding really do provide a backstop on what we can actually provide and when and where and how. And so we have needs beyond that. Community has needs beyond that. How are we partnering with others in our field to really lift that up? And how do we do that under an FRC structure? And of course, participation is voluntary and therefore only when we have funding. So if you're working this as a model around funding, if your vision is about getting funding for your agency, this isn't the conversation for you to have. If your vision is how do we lift community, how do we build community, how do we support and provide resources community collectively as organizations, as an organization or as organizations working together, this is a conversation that you need to be having. And then that will help promote what you're doing and how to promote you as an agency. You'll be lifted up. It's the tide lifting all boats kind of thing. So you'll be lifted up if the group is successful, if the FRC is successful, and you can evidence that through a variety of tools. So looking at all those, braiding those pieces, whether they're community funds, state funds, federal funds, all over the place. And I tried to stay away from that because you got that from Chris and you got from God how they work it together. We're not any different. We use the same funding sources, the same ones that are there. So I wanted to kind of challenge the structure to say, wait, you don't have to do everything too. You can be partners that can help to help support and supplement and complement your work. And that is all for me. Thank you.
All for you, all for kids. Thank you so much, Ron. And I love how you took a little bit of a different approach and rounded out because so much of what you said is so critical. Relationships, communication, work together. Like those are all the soft pieces and they have to go hand in hand with getting the funding and also utilizing the funding. So, we are a little short on time. You can go to the next slide because this is my like dream vision and I just wanted to share it with everyone. This is maybe particularly for you networks out there. How do we get our hustle on and really get our states and locales to think about how we take these funding streams and utilize them together, braiding them in order to get the services to the families in need. What rock haven't you looked under yet? What government and federal funding rock have you not looked under? If you don't know about Medicaid and what's available in your state, you need to know. You need to understand it. I have two questions for the audience, and then we're going to open it up for Q&A. I've seen a couple so far in the chat and in the Q&A box, I guess we'll call it, in the Q&A chat. But I want to ask you to jump into the chat and answer first. What funding sources do you currently access in your FRC, or if you're a public agency, what do you know are being used currently to support families? And then secondly, what are the barriers that you're facing around braiding some of those funds? Where do you find that you just can't get around the silos that exist? And thank you, Brenda, for adding that. So Brenda, over to you. Thank you so much, everyone. I'm so glad we're seeing some folks answer in the chat. Thank you.
Yes, thanks for hopping in, folks, and beginning to share a little feedback. So we have examples of local government funds, grants, and private donations. That's some examples of current funding resources that you're accessing to support families. What other ones? Hannah says federal funding, including ARPA for the time being, state funds, private funds, recurring monthly individual private donors, and in-kind donors through drives and concrete supports. Looks like foundation funding and most recently funding from local governments, philanthropy, grants, partnership agreements. Got some more grants, annual appeals. First I've seen in the chat of that. School-based funds, state funds. Thank you, Sandra. Cindy says we get funding from OEC State. They're really popping in now. Suzanne says only philanthropy, as we haven't gotten funded through state or supported to utilize federal dollars. And I see some barriers coming in. Mary reports that current barriers include the current political climate or funder apprehension. Let's see. Oh, there's a lot. It's funny how the mouse just jumps around with it. Heather wrote state and national grants, but it's getting scary because of a lot of the grants are through the Department of Education. Aaron reports that county and state, which have been deeply cut this year, and that foundations are a big part, and that they get small amounts from Medicaid reimbursement. And Angelina, congratulations on opening your first FRC later this month. That's a huge feat. And learning about your funding options. I'm really glad you came and joined today. You might want to share the recording of this with your team. Rachel says federal contracts and philanthropy. Another shout out by Mary to annual fundraising events, and just launched the annual giving campaign. An excellent way to galvanize support at the local level is through that strategy. Excellent. I did hear a couple of barriers. So just like revisiting that barriers question, what are some of the barriers right now that you're experiencing toward sustainable funding and or blending and braiding funding? As I get the answers in for that, I see Joy Baker. Hi, welcome Joy from Oregon. They're launching in Lower Oregon, are one of our newest members this year, and they have a 501c4, so they hold relationships with state policymakers and private funders. Federal funding cuts and the increased pressure on philanthropic communities seem to be the biggest barriers to braiding funding right now. So curious to hear from our panelists. Any initial thoughts or feedback from what you heard from the audience and our participants in terms of barriers as well as funds that they access? Ron.
I'll just jump in really quick. You know, the National Family Support Network does a lot of good and has a lot of resources available to support FRCs and the benefit, the financial benefit. You can go on the website, you can see the studies, the Casey studies that are there to say, these have value. You save dollars by using an FRC in your community. So I would encourage everybody there to go back to the network website and dig those data out, as you can go and prove that these are really helpful to your community, that you're going to save money and the community is going to save money, the government's going to save money in the long run.
Ron, thank you so much for that shout out, not only to the resources available at the nationalfamilysupportnetwork.org, but also the projects that have been funded and led by Casey Family Programs around the return on investment studies and really looking at the social return on investment. And there's data, the initial ROI study was out of Alabama. We have data from Orange County, California, Teller County, Colorado, on the social return on investment with real concrete numbers on the human savings, the social savings, and the financial savings. It's really a three-part pillar to making the case for family resource centers just being a gosh darn good idea at all levels at the community level. And so you can access those resources to really make the case of the value proposition of FRCs. And also, in case you're curious about school-based FRCs, we're in the process right now with Casey Family Programs doing a Kentucky quasi-experimental study on the impact of school-based family resource centers. Kentucky has close to 1,000 in their state of school-based FRCs, the largest in the country. We're really excited to see that progress as the study moves along this year. Okay, a couple questions coming in, and I'll just field this to anyone. So what databases can we use to search for federal and state grants?
Well, I think, there are, I don't know of one, maybe someone else does, that specifically, Aaron mentions foundation directory. They do tend to be around foundations, but your state may have a portal that focuses on state level grants. I know certainly we have jurisdictions that do that, like LA, that puts all of their open RFPs in one place. I would certainly love to hear about if there are places that do that broadly. There are certainly some organizations that focus on particular areas like behavioral health that might require some sort of subscription, but so much of this, y'all, comes also down to relationships that you have, whether local or state. If you don't know your representative in your area, your state representative, it's one of the first things you should be doing. Set up a meeting, tell them about your work, tell them about your organization, make sure they know who you are, because the opportunities then come, but those relationships are key.
Thank you. And also noting in the chat, we have the website www.grants.gov. So that's one resource that you can go to. There's statewide resources that Aaron shared, like in Washington, it has the WEBS for government grants. Also beginning to use some of the AI technologies to scour websites. We are putting on a training and just have launched like AI for Family Resource Centers of how to begin to incorporate it into your FRC that we'll be offering publicly at the beginning of next year. And it really is a way to mass leverage time and resources to at least get some better inputs coming into your purview in terms of opportunities that's really out that it's out there for you to leverage. And what is there's a couple questions also that were in the Q&A here for a little bit of time. One was around FRCs in California, and the question is, are they connected through any statewide closed loop referral system? For example, a platform that tracks referral status or outcomes? And if so, what's in use and who manages it?
So I've actually been chasing this for a number of years, and trying to create something. There isn't anything across the state. There are some closed systems within some counties or within structure, but it's nothing across the state. As I mentioned, we don't even know who the FRCs are in LA County, let alone who they are in the rest of the state. But there are a number of things that are being used. There's Unitas is used, but it doesn't have the referral structure and the follow-up structure. There's an organization called Chorus that I'm working with that does mostly in the healthcare arena, that I'm trying to get them to adopt their process so that we can do the real follow-up, the real referral, the real warm handoff process. I'm working with Continuum Cloud. LA County is trying to define its own, which by all accounts isn't working very well. So I can tell you a little bit about those that are out there, but there's no coordinated structure at all across the state.
If I could just add to that, yes, I would second that there are not one coordinated system across the state, but in San Francisco, as part of the Family Services Alliance, that is a project that the Alliance has been exploring and has had several conversations with Unite Us. There's another one that the city seems to be advancing called Find Help. And so we are exploring what that would look like for the Alliance across San Francisco to have a shared database, a closed loop referral system, because we recognize that our families are entering multiple doors and multiple organizations, and how do we again track better data, support families in a more uniform way, and be able to say something about our outcomes. And so more to come on that, and we'll see where the Alliance lands on which system seems to work best. But it's complicated, right? Because everyone has to agree to the one system. That one system may not align with anyone outside of that particular alliance if the city chooses to go with a different path. And this has kind of been a challenge across the board with these data systems and closed loop referrals. So we're still exploring what that will look like.
And just one more thing is, as when in Chris's presentation, you heard about the community pathway funding. This could be critical to obtaining community pathway funding for FRCs, by the way. So it's a piece that's floating out there, and it's one of the reasons why I'm chasing at the moment so that we can set up FRCs for success across the state.
Thank you so much for diving into that answer. We have about 1 minute left for, I'm hoping to get 2 quick answers, and then I'll close us out with some of the additional resources. There is, Chris, in your presentation, you shared that there are 17 states in the research that you did that have community health workers that can be reimbursed for funding at the FRC level. How do they access this list? Does this list, how might they start Googling to find out if they are one of those states?
Your Department of Healthcare Services, it might be called something different in your state, but your Medicaid system leader organization should have on their website information about what the Medicaid plan is for your state, and it would be coming under your state plan. So start there. Please reach out if I can be of help. I found that through Google myself.
Awesome.
Help from AI. So yeah, I'd be happy to dig in with folks around that. It's always a little bit of finding a needle in a haystack, but once you do, there are some real gems out there and things people have not thought about. And in a moment of, difficult financial times, which I'm seeing a lot in the chat, we really got to hustle. We got to find those pennies in the couch cushion, so to speak.
Absolutely. Pega, this last one's for you, if you could do it in 30 seconds or less. There was a question about the reference to the Talkline volunteer program that you have. And the answer, or the question was, what is the training required for Talkline volunteers?
Sure, I'll try my best to do it in 30 seconds. It's actually a very rigorous training. It's offered twice a year, and it's about 40 hours of virtual training that the volunteers go through. And then they hold shifts throughout the week, to about 4-hour shifts at the minimum, to be able to answer the calls. And the training generally covers topics like trauma-informed and healing-centered care, harm reduction, crisis intervention and de-escalation, the 5 protective factors framework for strengthening families, and a peer support model, so that when families call, they can be able to meet the families where they are at. And the other piece that is really important is that they have resources that they have information on to help connect families in the moment that they may need some sort of resource or connection to, or referral. And so that is, generally speaking, the training.
Fantastic. Thank you so much for sharing that. And just want to say thank you to all of our presenters today. Your passion, expertise, and insight into what can feel like a really overwhelming, complicated concept of blending and braiding as special federal funding streams. I appreciate the examples, the way that you broke it down, and the impact that it's having at that local level. Ron, your key questions and insights to help really frame the thinking moving forward is deeply appreciated. We'll be bringing more to you on blending and braiding and funding for FRCs all throughout the rest of next year, and excited to continue our work with Chris Donor-Mertz and helping us really carve out a space for FRCs to have a cheat sheet when it comes to looking at federal funding streams. Before we close out, I just want to share a couple additional resources. If you like today's webinar Wednesday, we have so many of them recorded in the bank for you to access. We have them across and featured on family resource centers, family resource center networks, looking at standards quality implementation, looking at parent leadership development, and webinars that advance the field. We actually have another webinar coming up next Friday. We'll be in Florida. So we'll be doing this live webinar. Julie Matusik will be out of Florida next week on developing family resource center networks, with the question of where do we start? So folks who are interested, you don't have a state network in your state and you want to join our map and be amongst your peers across the country, helping move the needle for FRCs at the statewide level, that webinar is for you. And then December 3rd is our From Under the Radar to All the Rage FRCs and FRC network. So this one goes really deep into the nuts and the bolts of both family resource centers and networks. We also have one left open training for the year that hasn't been sold out, and that's our Connect with Effect outreach training. These are the essentials for family support and strengthening programs on effective tools for outreach and engagement based upon the best practices from the standards and our Parent Advisory Committee outreach training. This is also co-trained by our staff as well as parent leaders. And if you have any questions, comments, and even complaints, you can email me, Brenda McChesney, at the National Family Support Network. We will close out today with a brief survey. Please take a moment to fill it out. It helps us to guide our future programming, especially as we look to 2026 for figuring out what are the most hot topics that you'd like us to bring to you to help advance the field of FRCs and family support. Once again, a big shout out and round of applause to Chris, Ron, and Pega. Thank you for your time and for being here today and being on the ground every day helping to support families. We appreciate you greatly and wishing you all well from the NFSN. Thanks, everyone.